The American Epilepsy Society has the main function of providing resources and education for professionals working in the field of epilepsy. So that includes neurologists, are a large contingency of our group, but also includes researchers across the entire spectrum, including basic science researchers to clinical researchers, neurosurgeons, neuropsychologists, and advanced practice practitioners, pharmacists. So it's a wonderful society that really brings together all of us to figure out how we can better advance the care for treatment for people with epilepsy. When I'm seeing someone in my clinic, women with epilepsy during the childbearing years, there are two main things I think about that I need to add to my treatment plan for them above and beyond all the patients I see, which is to think about, one is the effects of cycling hormones on seizure control and how that may also interact with their medications and effective contraception. And then I also need to always think about, it is possible that 2 weeks later I can get a call that she is pregnant, whether she planned it or not, because 50% of pregnancies are unplanned. So I am always thinking ahead of that next step of how we can use medications that are safe for a future pregnancy, but also effective for her epilepsy and for her as a patient. So studies in women with epilepsy during childbearing years and pregnancy are difficult to do because we can't do randomized placebo-controlled trials. So we usually take an observational approach prospectively, and we gather information on several factors. So the WEPOD study, the primary aim was looking at fertility. And what we found in that study was that women with epilepsy had the same rates of fertility as the healthy control women that we enrolled. And so that was great news for women with epilepsy because they would often come into clinic and wondering, can I get pregnant? MONEAD study is really the next step, and that's also a multi-center study, but an even larger study with 20 sites across this country. And we're looking at several factors of how we can keep the seizures controlled during pregnancy and postpartum, but also looking at the consequences of our treatment and of seizure control on neonatal outcomes, obstetric complications, and then also long-term neurodevelopmental effects on the children that are born to women with epilepsy. We also have a component where we're looking at mood factors during pregnancy and postpartum and seeing if women with epilepsy are more susceptible to the effects, again, of the cycling hormones and increasing rates of postpartum depression. The main thing is really to talk to her provider, so to talk to her neurologist, also her OBGYN, but a lot of times the communication with an OBGYN occurs after conception, and it's really important prior to conception to get on the correct vitamin supplementation and also the correct regimen of medication that will be safe during a pregnancy to her unborn child, but also that is appropriate to provide for her the best seizure control possible. Well, I think AAN is such a unique gathering, really, of neurologists across all different areas of subspecialty, general neurology, and different practice settings, whether it's in an academic ivory tower, like several of us, or whether it's in a rural setting where a neurologist is treating all types of different neurologic diseases. And so the communication that occurs back and forth between the latest research advances and how those can be implemented into practice across providers is really key and something that is unique about the meeting.